If you have spinal stenosis and leg pain, numbness, or heaviness increases after exercise, that's a signal that the movements you're doing are increasing nerve compression inside the spine. After working with thousands of patients over 35 years of clinical practice, there's a clear pattern I see over and over again. Most flare-ups are not random, and they are not caused by weakness or lack of effort. Often they are caused by specific exercises that increase spinal compression and nerve irritation, even though they are commonly prescribed as safe. In this video, I'm going to show you the 3 types of exercises that consistently make spinal stenosis leg pain worse. Once you understand which movements are quietly aggravating your nerves, everything changes. You stop blaming yourself, you stop fearing that stenosis is rapidly progressing, and you gain immediate control over your symptoms by simply removing the movements that are driving the flare-ups. I'll break it down, each exercise, and explain exactly how it narrows the spinal canal or increases nerve pressure, and help you understand why your symptoms spike after doing them. This is not about stopping exercise, it's about choosing movements that your spine can tolerate. And if you stay until the end, I'll point you to a safer exercise, actually a number of safer exercises that actually improve walking tolerance and confidence without pushing you closer to surgery. Hi, I'm Dr. John Zielonka. I'm a neurofunctional chiropractor in Ottawa, Ontario, Canada. My YouTube channel focuses on helping those who have been suffering from debilitating chronic back and neck pain. Before I dive into today's video, I need you to smash the subscribe button if you want to learn more tips and strategies on how to treat and relieve debilitating back and neck pain without drugs, without surgery. I upload a new video every week. With spinal stenosis, the movements that irritate nerves do not always cause pain immediately, which makes it harder to connect cause and effect. This is why spinal stenosis behaves very differently from other back issues. The spine can tolerate only so much compression before the nerves react, and the response is often delayed. You may finish an exercise session feeling looser, but later that day or the next day, your legs feel heavier, more painful, or harder to trust. This delayed response is one of the biggest reasons people get confused and discouraged. The exercise itself does not always feel bad while you're doing it. The problem shows up when irritated nerves are expected to recover from repeated narrowing and pressure. That's why walking tolerance drops, standing feels harder, and symptoms feel unpredictable. It's not random, it's cumulative. Once you understand this, everything becomes easier to interpret. Flare-ups stop feeling scary and start feeling informative. They tell you which movements your spine does not tolerate well. In this video, we're going to use that information to your advantage by identifying the exact exercise categories that reliably increase nerve compression in spinal stenosis and make leg symptoms worse, and obviously then avoid those. We will start with the most common one, repeated spinal extension, and why movements that bend the back backwards are often the fastest way to trigger leg symptoms in stenosis. So extensions are movements where the lower back bends backwards. So if we have the vertebrae, we're actually coming backwards. And when we do that, we're compressing that whole area. So when we bend backwards repeatedly or it's held at end range, they're often prescribed to improve mobility or posture, and they're often prescribed for disc herniation patients. But in spinal stenosis, extension exercises frequently increase nerve irritation instead. When the spine bends backwards, that space around the nerves becomes smaller. In spinal stenosis, that space is already limited. Repeating these movements increases nerve pressure, and the response is often delayed. So leg pain, numbness, heaviness shows up later, not necessarily during the exercise. Examples include things like prone press-ups, cobra stretches, aggressive back extensions, and prolonged standing back bends. Many people feel temporary back relief, then notice reduced walking tolerance or heavier legs later that day. Safer options avoid end-range backward bending and focus on reducing compression. Gentle posterior pelvic tilt movements, flexion-tolerant mobility, and supported hip motion are often better tolerated. Removing repeated extension is one of the fastest ways many people reduce flare-ups. Remember to watch right to the end because I'll show you a video that gives you 5 easy-to-do exercises that have been shown to give leg pain relief in spinal stenosis patients. The second exercise that commonly aggravates spinal stenosis leg symptoms involves high impact and what we call heavy axial loading. That means we're doing those compressive forces like this. These movements place strong vertical force through the spine, either through impact or heavy compression. For many people, this is where symptoms start to quietly spiral. Each impact or heavy load increases pressure through the discs and the joints and transfers that force into already narrowed nerve spaces. The effect is rarely immediate. Symptoms usually show up later when you try to walk, stand, or move around that day, or even the next day. Walking tolerance shortens, legs feel heavier, and confidence drops, even though the workout itself felt manageable. Common examples include running, jogging, jumping exercises, step aerobics, heavy squats, leg press machines, and stair machines. These movements feel productive and familiar, which is why they're often blamed last. Safer options focus on staying active while reducing compression, walking with a slight forward posture if tolerated, cycling, pool walking, unloaded lower body strength that work in comfortable ranges are often better choices. When impact and heavy loading are removed, many people notice steadier walking tolerance and fewer delayed flare-ups. The third exercise that often worsens spinal stenosis leg symptoms is prolonged core bracing and long static holds like planks. Now you're going to say, hold on, I thought I needed strong abs for a good core. Strong abs are one part of that, but you don't want to do that at the expense of aggravating the stenosis. So these exercises are usually prescribed to protect the spine, but for many people with stenosis, they increase intra-abdominal pressure, nerve compression, and stiffness instead. Holding the core rigid for long periods limits natural spinal movement and increases pressure throughout an already sensitive nerve area. The effect is often delayed. People finish the exercise feeling stable, then later notice heavier legs, increased back tightness, or less confidence when standing or walking. Common examples include planks, long wall sits, sustained abdominal bracing, and hollow body holds. These exercises look controlled and safe, which is why they're easy to overlook. Safer options focus on short bursts of core engagement paired with breathing and movement, gentle movement transitions, dynamic movements, and exercises that allow the spine to move like a cat camel are often better tolerated. Now that you understand which exercises most commonly aggravate spinal stenosis, the next step is understanding what changes when you remove them. So this is the part most people worry about. If you stop these exercises, will you get weaker, stiffer, or lose progress? In spinal stenosis, the opposite is often true. When movements that increase compression are removed, irritated nerves finally have space to settle down. That changes how your body responds to activity. One of the first things many people notice is that walking becomes more predictable. Legs feel lighter, standing tolerance improves, flare-ups happen less often and are easier to trace back to specific triggers. This is not because you're doing less, it's because your nervous system is no longer being pushed past its tolerance. Strength and endurance do not disappear when compression is reduced, they often return. So when nerves are less irritated, muscles can work more normally, and they actually fatigue more slowly. Movement starts to feel safer again, which restores confidence and consistency. This is what actually preserves independence over time. This is also where fear starts to drop. Symptoms stop feeling random or progressive and they start feeling manageable. You gain control by understanding what your spine tolerates and what it does not. You now have a clear framework that can finally help you understand why your symptoms flare and what to do about it. Instead of guessing or pushing through pain, you can start choosing movements that protect your nerves and support your ability to walk and stay active. If you found value in this video, like it and share it so others dealing with spinal stenosis can avoid unknowingly making their symptoms worse. And if you have questions, drop them in the comment section below. I read them and they help guide future videos. Subscribe to this channel if you want straightforward explanations and realistic strategies for relieving chronic back and neck pain and protecting your independence without relying on drugs or surgery. New videos are posted weekly. As promised, here's the next video you should watch: 5 easy to do exercises for quick spinal stenosis relief. If you want to learn simple, safe movements that reduce nerve pressure and help you start feeling better quickly, please go watch this video.